Good evening, Board of Health members. This is Troy, your virtual host. We are live and recording.
Thank you very much. First, I'd like us all to stand for the Pledge of Allegiance. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Mr. Pratt, are you on the line?
I am, Mr. President.
Okay. Well, we're looking for an attorney certification of the agenda, please.
Thank you and good evening, board members. The County Attorney's Office has reviewed all of the items on your agenda for this evening, and they meet legal approval.
Okay. Are there any member disclosures for any items on the agenda? I have none.
I have none, thank you.
No, sir.
No, sir.
And I presume Linda's not joining us today?
I have not heard from her.
Okay.
Oh, Kim? Yeah.
Kim, excuse me, Kim, I'm sorry,
Yeah.
Dr. Fielding.
Linda.
Kim. Okay, well, nonetheless, we have a quorum and we're ready to go. Has everyone had the opportunity to review the board meeting minutes? And are there any changes to those meeting minutes?
None here.
None here?
None here.
Okay, in which case I would seek a motion to approve the meeting minutes in a second.
Mr. Chair, I'm happy to, Mr. President, I'm happy to offer a motion to approve on a consent agenda item, the minutes from the regular meeting, May 12th, 2022 at 5 p.m. of this board.
Perfect.
Second.
All in favor, say aye.
Aye.
Opposed? Thank you. So we have a regular agenda, information items. Director Hill, I would turn it over to you.
Okay, thank you. So first thing I'm going to do before I forget is introduce the staff, because we've got almost 50% of the health department is here. So I think everybody knows Dr. Smith, who is our medical officer. He's been here before. In the back, in the center of the right side, is Caitlin Gappa, who's the assistant director over environmental health. Next is John Serbeck, who I think you all know, who runs emergency preparedness and response and communicable disease control, which is a mouthful. And over here is Bryn Turnbaugh, who is the administrative assistant for the health department, who's learning how to run these meetings for us. So that's most of your team. We had a couple of others that were supposed to come, but maybe are still closing up shop over on South Wilcox. So then I'll get into my prepared remarks. Again, I'm not going to read it. A lot of work to get Vital Records up and running, and the Vital Records office successfully opened on June 1st. We've been selling certificates, not at a fast rate yet, which is kind of good. We did a soft launch so that we have a chance to figure out the ins and outs. There's some challenges to the state system and not always behaving itself, so we're learning and getting ready. Soon we'll do a big promotion on the Vital Records office to try and drive more business there. But one of our clerks has already gone out with COVID, so it's just as well we're not going to do a big push till next week when she's back online. Still been meeting with the other two counties and with Tri-County, trying to work out things and where facilities are going to go. We understand more so in our county than the others, but there's some discussion on facilities and furnishings and fixtures and all that stuff that's keeping us occupied. Let's see what else I need to say. We're still working on the assistant director over the community health division of the health department. We've got interviews coming up next week, and all of us and Dr. Smith are going to participate in interviews to try and get we've got some really high-powered candidates for that position, so I think we'll get someone good in there that hopefully we can introduce next time. And other actions I've taken as I accepted $4.1 million in additional pandemic funding that goes through next July. Also today I received $182,000 in public health emergency preparedness funding, and there's still bits and pieces of state funding that are straggling in, and I'll add them as time goes along. And I'll be reaching out to the commissioners next week to get their approval of my acceptance of all these funds so that we can get them into the budget and start expending them. We're having some challenges as far as our request for proposals to get clinical services. We're still working on it. We'll get something worked out, but it's going to take a while. And I've talked a lot with Tri-County, and I'm fairly confident that they can hold up the clinical stuff till mid-December at least. They pretty much would have to start shutting it down in mid-December just to clear out pharmacy supplies and give patient notice and all that kind of stuff. So we've got time there.
Can you expand upon what are the challenges you're facing?
Well, I think it comes down to a failure to communicate. I get to use that line in a meeting. So basically, what we asked
Only
for.
movie buffs understand what's happening right now.
Once in a while, see if you catch them. But so what was proposed by our single respondent was not necessarily what I thought I was asking for. So we've had one meeting where I kind of suggested that they go back to the drawing board, and we'll have more meetings with them. We're also, since we only got one respondent, we're able to reach out to other participants in the community who might be interested. So we'll get the clinical picture straightened out before December for sure. Things like WIC, our WIC application is going to go out the door. It has to go out by Tuesday. So at some point, the state will tell us whether we're going to get funded for our own WIC program, in which case, we'll get that fired up probably October, November, because it's on a federal fiscal year basis. So we're still in good shape. Everything else will be ready and done by September 1st. After that, all we'll have left is the clinical nutrition type programs and health promotion. So I'm going to be asking tonight and with the commissioners next week to push forward in my hiring plan to fully flesh out the 3 divisions that are up and running, leaving a lot of unknowns still in the community health division, which is where the clinical stuff will be. And I'll, as we figure out what the funding is, what the contractor availability is, I'll come back and we'll work out the details of getting that through. And also, I got approached by the Douglas County Collaborative Management Program to sign on as a member. Their legal requirements are that the local health department be a member of that. I did not find anything that seemed to obligate us to do much or to spend any money. So unless the board objects, I'm inclined towards signing that agreement with them tomorrow.
Would you tell me the name of that group again? I don't know that I've ever heard of them.
Well, nor have I. Douglas County Collaborative Management Program. And Tri-County has been the local health department representative for all 3 counties thus far, but since they're going away, they're required by their statute to have a local health department participation. So for them to go forward, they need us to sign on.
I don't have any concerns about that. Tri-County had belonged to them in the past, is what you're saying.
Correct.
Thank you. I have no other questions.
All right. And that is the highlights of my report. Willing to entertain any questions you might have.
Do you have, Commissioner? I'm sorry.
Well, I do. When it comes to the revenue that you've been bringing in, Mike, I wonder if we could have perhaps at next month's meeting, if even as just an informational item, what that looks like. I know the detail of what revenue pieces have come in from beyond the budgeting here within the county, just because that's been a question that I received from the Rotarians yesterday. So just to be able to answer that question when it comes from a resident, that'd be helpful for me.
Sure, and we've been working on something to put on the web, like a graph or chart that will represent, what the sources of funding are. We just haven't come together agreeing on how that should look yet.
Okay.
Yeah, I can put together an agenda item that'll describe everything I'm going to take to you and the commissioners next week.
Okay.
I was thinking similarly to Commissioner Teal is funding, and also it would be interesting to see like an org chart, and then an org chart with okay, here's what's been filled, and here are the vacant spots. Because what's on my mind, and probably what's on other board members' mind is, okay, we have certain deadlines we need to meet in order to be up and running. And it would give us some idea, I think, of, progress that's being made. As I've been thinking about this, it strikes me that there are two overarching issues, I think, that could be, that could stand in between us and being a fully functional health department by the end of December. One is funding, whether state funding or federal funding doesn't come through, and the other is staffing, whether in an economy where the premium is on the hiring is difficult right now. The premium is on trying to hire good people, and there's a lot of demand out there for employees that could create difficulties for us if you can't attract the best employees. And so I'm just trying to think through and make sure that we're thinking through, what could be the problem, and then if we identify the problem early, how do we address it?
Sure, and we've actually had pretty good luck with hiring people,
Is that right?
surprisingly so. And we've had well north of 100 applicants for our positions, and we've only filled 10 positions so far, I think. So we're doing okay in attracting applicants, and some of that will be covered in the last item on tonight's agenda, where my chart shows what's been filled, what's in the process, and what I'm asking for permission to go forward. But I'm really, surprisingly, we've had an easy time getting quality applicants.
And the state has been, and Tri-County have been agreeable in working with us on funding. There haven't been any issues there.
Yeah, the state, last month I mentioned to you an $853,000 allotment that I had no idea about, that they just emailed me one day, here's $853,000. So I'm favorably impressed with their attitude toward funding us. I think we're doing well.
Thank you.
And one thing I did want to add on, I had a request to talk about COVID a little bit. So in keeping with the rest of the country and the rest of Colorado, our numbers have been creeping up. Our positivity, 7-day positivity was like 11.5% 2 weeks ago, and now is up to 12.2%. So there's a gradual upward creep in the positivity. There's also a commensurate increase in our 7-day average cases, which is up to like 1,334 cases. So it's rolling upward. And John, if I misspeak, jump up and correct me, but I'm reading tiny print trying to relate here. Our vaccination rate is still 80.6% overall with one or more doses. 75.9% of people that are fully vaccinated with the main series, and then 60.3% of our residents have had a booster. So that's part of the reason that even though our positivity is going up, our hospitalization rate and death rate are not going up. So we're like the 7th most populous county in Colorado, and we rank like number 10 on cases, on hospitalizations, and number 14 on deaths. So a lot of COVID out there, but we're getting through it. And I've got numbers here if anybody has questions on specifics. Happy to try and read them and relate them to you.
Actually, I do have one question, sir. Has that leveled off, or is it starting to decline? Or is it still going up?
It seems to be a fairly constant upward. It was like, this is as of the 4th. So on the 4th it was 12.2, but the day before it was 12.1, the day before it was 11.9. So it's, it's not a parabolic increase, but it's gradually trending upward.
Yeah, because there is a trend in the nation as a whole, if you look on the CDC's website, that actually there's a wave of COVID that appears to have been going from the East Coast through to the West Coast. Mm-hmm. And people were getting peaks starting in May, starting to decline on the East Coast. So I'm suspecting if the CDC's numbers are okay, that we should start to see this level off a little bit with the summer. And I'm hoping. I am hopeful.
I hope the same thing, and I think it really is, because I look at these numbers every day. I mean, I got these from the professional epidemiologists, so they're better
Oh, yes.
numbers, but I look every day, and
Our modeling team.
it's not scaring me, so.
Yeah. Okay, well, thank you very much.
Well, I mean, if it pleases the board, one of the things I'd want us to really focus on as we kind of work through this wave that you described, Doctor, is that, we keep a focus on severity.
Yes.
I mean, the cases could be a canary in the coal mine that we, does cause us to draw attention to it. But our focus, should we see a call to resume some of the control measures that were so divisive within our communities over the last 2 years, before we actually take action on those as a Board of Health, I'd like us to, make sure we truly benchmark on severity and the actual risk to the public before we take any control measure actions. If that's a philosophy that the board would be interested in coming to consensus on, I would put that out there for us to kind of establish that as our direction for our public health director.
Yeah, and I don't think we're headed toward any control measures at this point. There's been a focus away from, just the raw case numbers and the positivity, because with so many people being vaccinated, a lot of people are getting COVID, but they're not getting hospitalized, they're not dying from it. So there's a kind of a new world in the CDC and CDPHE as far as how they want to react to these numbers, I think. So I don't get the feeling that they're going to suggest anything anytime soon as far as dramatic, draconian reaction.
Yeah, and one other thing is I'd like to keep it in perspective, as I had said earlier, that we also keep an eye on other respiratory illnesses and our communicable diseases, because as a Board of Public Health, we have, other obligations too. And if we're going to get another spike of respiratory syncytial virus or other illnesses, we should really, keep everything in perspective.
Yeah, we'll get the epidemiologist to get up some kind of listing of RSV and the other diseases, and not just the respiratory diseases, but I want to have a dashboard of all of the communicable diseases in our community, so we know while we've all been diverted on COVID, has something else run amok and we don't know about it. So I'm trying to get a track on that and get it, again, presented on our website in such a way as the public can just look and see where we are at any given time.
I appreciate that, because I don't want to be blindsided with something like drug-resistant TB or something else when we're just focused on COVID, because there are a lot of other nasty things out there, and we should be looking at everything and putting them all in perspective to allot our resources.
Sure.
Really good point.
Yeah, and it goes to a conversation the president and I had before, of where you talk about making sure we do get that detail out in a web format that the public can see, of, making sure at the very least we're an honest broker of information here. We're a conduit, we're a source of information for the public at large. And then if we're a source of advisory before we become, revert to some of these control measures we've seen in the past, I think that would be filling the desires of our community.
Yeah, and we officially become in charge of those matters on July 1st. Right now, it's still Tri-County, so I think we're headed in a good direction to provide better information to the community.
Excellent.
Other questions, comments?
I agree with the previous comment Commissioner Teal made with respect to sort of approaching any additional control measures thoughtfully with the data, making sure we're reacting, after, really some deliberation. And I just want to agree. I just want to say I agree with the point that you made. So,
Thank you, sir.
all right. We still have notice of regulations planned for a public hearing.
Yeah, so in order to take over environmental health on September 1st, we have to have a couple of local regulations in place. A lot of the environmental health programs are covered by state law, like the restaurant, the food establishments. We're doing that as a delegate of the state, so we don't need our own regulations. But the on-site wastewater and the body art, we need our own regulation. And basically what we've done is cleaned up Tri-County's regulations a little bit and then stuck in a repealer that says Tri-County's regulation is hereby repealed on September 1st and replaced in whole by this new Douglas County regulation. And that's pretty much the case for both of these. The reason it has to be on tonight's agenda for public notice is that we also have to send the wastewater one to the state to review. So we need to get that out to them by, I think, Monday to meet that deadline. And then we can do a public hearing at this meeting next month. So anybody who wants to come in and comment on the regulations can do so before you all decide on whether to enact them. But there's no real substantive change to what's been going on in the county for years. We can make substantive changes next year, but just to get us going right now, we didn't want to make changes.
Okay. That sounds great. And we are now moving on to the action item section. Request to fill additional positions for Douglas County Health Department.
Yeah, so I should have printed these out for you all because the color codes didn't work last time. Well, they look pretty good on Commissioner Thomas' sheet today, So basically, there are 4 divisions in the health department. I want to staff up 3 of them and just hire the leader for the community health division to help me figure things out. That would leave, the nurses that are going to work for human services, some clerks, the WIC staff, whatever we hire, whatever health educators we do for like the senior falls that we talked about and tobacco control that might be funded by the state. I'm leaving those as up in the air until I find out more about the funding and more about potential contractors to do those services for us. So I'm just looking for permission from you to flesh out the rest of the organization, and then I'll be taking that ask to the commissioners next week to get their approval.
There you go.
And the department's fully, like, on January 1 of 2023, how many FTE will you have?
I'm thinking we'll be in the 40 to 45 FTE with this health department fully fleshed out.
Okay. And you said how many do you have right now?
Now I have, let's see, I can count them. 1, 2, 3. I've got 8 right now.
Okay.
So going through the chart, going through the wire diagram, grant accountants times 2, QI coordinator, but then the personnel that you've specified for Castle Rock office, Lone Tree office, you're looking at not even, you're looking at recruitment from June through September. Is that correct, Mike?
Yeah, so we need that environmental health column that needs to be fully built out, ready to roll by September 1st. So we're in the process right now of hiring that environmental health supervisor, and we plan on that person running the Lone Tree office where most of the food establishment people would be located, because that's where most of the food establishments are. And then Caitlin would be here in the Castle Rock office and have most of the on-site wastewater, because most of that's down this way. And
Caitlin will have that long commute down Plum Creek Parkway.
It just seemed to make sense. There's space that we're not going to use for clinical services in Lone Tree. We can put this many environmental health people in that space that's being vacated by clinical, and then we're not, even though we're going to be supplying vehicles, so we're not paying mileage, we're not going to get as many miles on our vehicles as if they were all parked here in Castle Rock and somebody's got to commute down here from Lone Tree, pick up their vehicle, and then go back to Lone Tree to do inspection. So it just seemed like a good use of the physical plant that we have in our possession and all of our resources.
And then with the Castle Rock office, I mean, again, another question I do get from the public, we are talking about the former clinic owned by Jack England down here at the south end of Wilcox,
Right.
before it becomes the frontage road.
Right.
Okay.
Where it says Tri-County Health Department all over the front of it.
You're right.
We'll scrape that off in a few months and put Douglas County Health Department on there.
I don't know about you guys, but I've heard that quite a few residents are looking forward to that day.
Yeah. I am too, because people get confused, because I rent a little suite on the backside of that building, and they can't find me because they come up and it all says Tri-County Health Department on it. And then
right.
I've got a little subtle sign on the door around the corner, but we're getting there.
Very good. I think that looks okay by me. I don't have any further questions, Mr. President.
It looks okay to me, and before you move to this part, I heard some music to my ears when you said that the off-site wastewater treatment system was going to be repealing Tri-County Health's in September. So that was music to my ear to hear you say that. I just want to put that on the record. Thank you for everything you're doing to get this going so well, Mike.
Yeah, but by September, everything to do with public health, other than this clinical stuff, will be in-house Douglas County Health Department.
Okay.
Well done, thank you. And I have no questions or concerns. I think you've done a good job with this chart. Thank you.
Thank you.
Yes, it was a very easy chart to read. Do appreciate it.
That was the goal.
So it's an action item. I mean, do you need a motion to?
I would like a motion on the record that the Board of Health approves this, just so I'm not running amok out there. It's the same thing we did the first time. You approved the initial org chart, and then the commissioners also approved it.
Is there such a motion?
I'll make a motion to approve.
Second?
Second.
I have a motion and second. All in favor, say aye.
Aye.
Aye. Opposed? Excellent. Well, and that comes right on citizen comments. So let's just move to citizen comments versus comments on this specifically. Troy, or first, is there anybody in the room that would like to say your name and the town in which you reside, please?
John Fielding from the Pinery. I have a question about the proposed waste and a comment about the proposed wastewater regulations. I would like to know whether those apply or will apply to individual sewage disposal systems, otherwise known as septic systems. I have a personal interest in it because we have one. And for a long time, I can advise the board that for a long time, Tri-County had issued regulations regarding septic tanks. But it in effect delegated enforcement of that to our local water district, in our case, the Pinery Water and Wastewater District. And I can tell you that after a couple of years, the water district lost interest in enforcing those regulations because the regulations would require the submission of a pumping report or a service report by a licensed septic cleaner when you had your system serviced. And it got to the point where I was told by the people at Pinery Water that I was the only one in our development who was complying with these regulations, and that really there was no need to continue to submit this because all that was happening was that the water district was putting it in a file and forgetting about it. I was told that this was because there was an individual bureaucrat at Tri-County who for a time was very interested in septics and was the motivating force behind those regulations, and then that bureaucrat had left and nobody else was interested in it. And so the pressure was off, and they weren't making homeowners comply with these regulations, presumably which are part of what's going to be repealed in September. So I'm wondering if these regulations affect us, and if so, I'm letting you know that you may want to be working more closely with the water districts on monitoring compliance. Thank you.
Troy, do we have any, first, were there any other comments in the room? Second,
Mr. President.
Troy, do we have any comments online?
Thank you, Mr. President. I have no online comment.
Okay, thank you. Well, with that, Commissioner Teal.
Well, just to respond to Mr. Fielding's comment, I mean, Caitlin, I did see you scribbling, jotting down notes. Mike, I wonder if that would be something where, again, we're sort of building the airplane as we're flying it here, but in the past, it's a process that we always had in Castle Rock where if a citizen comment brings up a concern in terms of what the actions of the department would be, Mike, I wonder if that would be, we could kind of start a process here or start a tradition here where that'd be something where we can, I, as a board member, would be happy to have Caitlin probably visit with Mr. Fielding a little bit and probably get some pointers that could lead to action for her to take in her responsibility as the assistant director in environmental health.
Yeah, I think I would plan on, for this kind of question, developing a response for the next meeting. I don't want to be on the spot or put Caitlin on the spot tonight to try and answer, but, general questions like that, yeah, we should provide a response at the next meeting. I don't want to get into specific back and forth
Right.
with everybody, but that kind of response, yeah.
Well, and the meeting minutes will reflect the question that was brought up, so, so we can at the next meeting bring it up, and it should be something that you should just put on your.
And that's when we'll be having the public hearing
Right,
on the regulations,
exactly.
so that's a good time for it to come up.
Exactly. Any other comments? Yes, Commissioner Thomas.
Would you like to talk about?
I'm happy to. First of all, there was an excellent write-up on you in the local paper. I thought it covered everything very well, and I thought that you really laid out the goals of the agency, your goals, and what we're trying to accomplish very well. There has been some public comment with respect to the comments you made about liberties, and I know that I think you've talked to some folks about that, and I thought for the record you may want to, or do you want to amplify or discuss the intent behind the comments? I think I understand what you were saying. Having run a health department, I understand, but I wanted to give you the opportunity to speak to it.
Sure, and what I was trying to get across there, that interfering with people's liberties, making people wear masks, doing things like that is not my go-to move in public health. But I did say that if you were a typhoid Mary coming in and causing trouble for the entire community, we might have to restrict your activities to protect the community. But that's a last gasp effort. That's not my first move to go and round people up. It's let's do everything we can to educate, to move things forward and keep everybody safe without taking anybody's civil liberties away in any way.
Well, and Dr. Fielding brought up something that scared me when I was at the state health department, quite frankly. That among the things that kept you up was you said drug-resistant TB.
Yes.
That is scary, and that requires, at the time I know we were looking at what our authorities were, quite frankly, to handle something like that. But that is something where, action to protect the public would have been necessary had it shown up. And, honestly, after 9/11, I took over the health department after 9/11 when we started getting a lot of money for a lot of things, not just pandemics. We received a lot of money for that, but at the time we were worried about a smallpox, a bioterrorism attack. And, you started reviewing your authorities, and we started drafting our authorities so that we could respond to protect the public if necessary if something like that happened. So I understood completely what you were trying to say there. I think that, these are things that we don't like to talk about, but that a competent, well-run public health agency needs to be prepared to deal with, because there may be times that you need to protect the general public. So I thought that I thought the way you handled it was appropriate and sensitive, and thank you.
Thank you.
Yes, what you're saying and the approach you're taking makes a lot of sense. So I do support you here.
Thank you.
Thank you. Is there any other business? Any other comments? Any other thoughts? Critiques, criticisms? No? Well, in which case I would entertain a motion for adjournment.
So moved.
Yes. Second.
We have motion and second. All in favor say aye.
Aye.
Opposed? We are adjourned. Thank you.
Thank you.